background.
Okay, then I'll start off.
It's recording now, Councillor.
Sorry?
It's recorded now.
Yeah, I welcome all to the Birchfield Ward Forum meeting this evening. Introduction, my name is Councillor Mahmood Hussain, and I'm a councillor for Birchfield and chair of this Ward Forum. We have with us Dinu Moti from Public Health, and we also have our senior highway engineer, Carl Randall. Carl, do you want to say anything before we move on to the update, or you just wanted to say something about yourself?
Thank you very much, Councillor Hussain. Yes, I'm Carl Randall, Senior Local Highway Engineer. I look after Birmingham North, so a third of Birmingham, which are the Sutton Coldfield wards, Erdington wards, Perry Bar wards, through to the West Bromwich Albion football ground. So I cover 23 wards of Birmingham. My team look after traffic management, highway safety, road schemes. We work with the schools, the parks, education, etc. on designing and implementing schemes to help people get around, whether it's yellow lines, pedestrian crossings, drop curbs, H markings, disabled bay markings, everything the motorist sees and does. So that's a brief introduction to myself, and a little bit later, when you want me to, Councillor, I'll update you on the measures that we're doing in Birchfield Ward this year, and then a brief on next financial year.
We'll do that a bit later, yeah. Mr. Moti, if you want to introduce yourself too, please.
Absolutely, it'd be my pleasure, Councillor Hussain. I'm Dr. Moti. I'm a public health registrar. I work within the public health team at Birmingham City Council, and I'm today representing the council on behalf of the Director of Public Health, who couldn't be here tonight. I will deliver a brief update on coronavirus.
Before you do that, just do your introduction, and then I'll have to read out the next item, you see.
Sorry, I didn't understand.
Yeah, I said if you just introduce yourself at this stage.
Okay, sorry.
Yeah, just introduce. Have you done your introduction? That's all you want to say?
I have, yes.
Yeah, okay, thank you. Let me go to item 2, which is notice of recording. I have to advise that the visual online meeting is being held in public, and recording will be available for public future record. Item 3, which is a coronavirus public health update. And we are fortunate that we have with us Mr. Dino Moti from Public Health. And can I ask you, Mr. Moti, if you can just update us what's been happening so far and what sort of measures we are putting in place?
Thank you so much, Councillor Hussain. It would be my pleasure to deliver an update on coronavirus for Birmingham and for the Birchfield ward. We are approaching the 1-year anniversary of the first case in the city, and today Birmingham has a case rate of 165 cases per 100,000 population over 7 days, which is compared to the previous week of a 225 cases per 100,000 population. This represents a 26% decrease in cases, and it puts Birmingham as the 31st highest upper tier local authority in England. The spread at the moment appears to be occurring primarily through households and social interactions, and we will see that hospital admissions have been declining, and now they range between 29 and 57 new cases a day at University Hospital Birmingham Trust, and this is between the days of the 13th and 19th of February. We have seen through the pandemic that there is a lag between cases, hospital admissions, and deaths. We have seen a constant decline since the lockdown, but we have to expect that deaths will take about 2-3 weeks to come down even after hospital admissions have come down. And this is because there is unfortunately a lag to the health effect of the coronavirus. In terms of comparison to the region, we are coming down roughly at the same rate, maybe a little bit faster than other local authorities, but we had a higher number of cases to start with, which now is putting us more or less in line with other areas. Nationally, we compare, we are just, let's say we have a rate that's lower than Nottingham, but it's higher, just higher than Liverpool, just to clarify that. But we are coming down relatively fast and faster than Nottingham, for example. Our rates are reducing faster. In terms of Birchfield, Birchfield ranks joint 33rd out of 69 wards for the number of COVID-19 cases. And we have 25 reported cases for the 7-day period between the 15th and the 21st of February. Yes, this puts the rate at 1.99 cases per 1,000 population, which compares to an average of 1.71 cases per 1,000 population. The distribution in terms of age groups sees the largest, I would say, is about 60–70% of cases are between 20 and in the 20–39 and 40–59 age groups combined, while the rest is 15% in the 0–19 age group, 12% in the 60–79 age group, and 6% in the 80+. And this is roughly in line with the picture that we see across Birmingham. Instead, with regards to the ethnicity division, we see some differences between Birchfield and the rest of Birmingham. For example, among the Asian population in Birchfield, 49% of cases are among the Asian population, where for the rest of Birmingham this is 32%, and 22% of cases are among the Black population, compared to 8% for the rest of Birmingham. And the opposite is true for white citizens, where only 10% of cases are among white citizens compared to 40% for the Birmingham population overall. The other message that I wanted to deliver, and obviously tonight it's a bit of a shame that due to technical problems we couldn't have and answer the questions, is talking about testing and vaccines. When I talk about testing, we talk about mainly 3 types of testing. The first, antibodies testing, which is only available privately and is fundamentally used only for research purposes, as it cannot tell you whether you have an infection. It only tells you whether you had an infection in the past, and is not particularly useful at that either, given that antibodies tend to wane after about 4 months. So even if you are able to, and I'm saying this for the benefit of those that will watch us on the recording, even if you're able to purchase one of these, it's a bad investment in the sense that it will not tell you much. Instead, on the NHS, let's say on public, the public provision of tests includes 2 main types of testing. One, tailored to symptomatic people and it's usually termed as PCR testing. And it's very good, very sensitive, and it catches, it's very good at telling you whether you have the virus. It's not very good at telling you whether you're infectious or telling you what stage in the infection you are. To get one of these tests, one books online. There are 12 cities across the city, 12 sites across the city to choose from. For people who have no symptoms instead, there is a rapid test also called LFT test, lateral flow test, which is instead not requiring a lab, is very rapid, in half an hour can tell you result, and it is done serially to identify people who might be infectious. This test is less sensitive than the previous one that I described, the PCR, and therefore is very good at highlighting those that have a lot of the virus and are likely to be infectious. It's not very good at identifying those that are still in the early stages of the infection, and that's why we recommend that people do serial testing in order to catch those asymptomatic people, which we know can amount up to 30% of all cases. This test is managed in general by the council. One can visit the site and can book a test, or you can get information on how to book a test also at pharmacies, at fixed and mobile sites. The council sites, the council-run sites do not need an appointment, and it is recommended that if you are in a care bubble, so if you're caring for your relatives, your mother, your vulnerable elderlies, that you, before visiting them, do a test. That does not zero your risk of having COVID, but can put your, let's say, your confidence a little bit higher, and it can tell you that your risk to go visit and deliver the groceries at your mother's is lower. That doesn't mean that you can go and hug your relatives if you have a negative test, but it tells you that if you have a positive test, maybe it's better if you do not go and deliver that groceries yourself and you isolate instead, as per regulations. In terms of the vaccines, you probably have all heard on the news that the program is progressing on track. We have at this stage 9 priority groups, and the reason why those priority groups have been identified at this stage is that obviously we have a limited amount of the vaccine, and in prioritization we prioritize the virus to those that are most likely to have serious consequences and be hospitalized. So by deploying the vaccine to these 9 priority groups in order, we are aiming to avoid death, serious disease and hospitalization, and then we will move on after having vaccinated the most vulnerable to the rest of the population, which means that for a while all the measures with social distancing, hands, face and space, and infection control will still be in place, because we do not have reached yet a large enough population for infection to be stopped by the vaccination. But we have already seen from international examples, like in Israel, that the vaccine has produced a significant reduction in mortality. And unfortunately, we see that by comparison, those that have not had the vaccine tend to have a higher proportion, obviously, of mortality. So we are really encouraging everyone to take up the vaccine. If you have received the letter that tells you from the NHS that you are in one of the vulnerable groups and you have the right to book the vaccine, do please book it and get your first dose, because already that is reducing your risk of hospitalization and mortality very significantly. Yes, and again, the importance of maintaining, even if your vaccination, all of your measures cannot be stressed enough, because there is still a chance, although small, that you might still get the vaccine, the virus, get the infection and spread it. So getting the vaccine does not mean that you can stop socially distancing, washing your hands, avoiding to touch your face, and keeping all the infection control measures that we have kept throughout the lockdown in place. There is, as you probably heard again on the news, a lockdown relaxation plan that has been described in its first stages. It will be this time, compared to previous examples of lockdown relaxation, more gradual. And this is done because the government wants to see the data emerging from every step of the relaxation. And it will start, as you've heard, from reopening schools on the 8th of March. Beyond that, it's on the government website, the entire timeline, and again is dependent on the actual curve of the infection. And by vaccinating, we can stick closer to that schedule, because we will drive down infection and likely move on to the next step, which is non-essential retail and then leisure venues down the line. And this is really dependent on vaccine uptake if we get there, because the infection will be driven down by that effort. In closure, I wanted to also say that on the council, on Birmingham City Council's website, there are information about financial support for individuals that have to isolate because of a positive test, or because the household contacts of a positive test, and also information about how to access financial business support if you're a business. It's all available on the website. And again, many of you might have heard, Birmingham City Council has in place a program called COVID Champions that gives you access to fact-checked information, updates, and fundamentally gives you access to the truth about what are the most effective measures and what is the scientific evidence about COVID and about the measures to prevent it. And at the moment, as of the 22nd of February, actually, in Birchfield, we have only 9 COVID champions, and that would obviously be very desirable if we could increase those numbers. And in order to become a COVID champion, you can visit Birmingham City Council's website and apply to be one. It is a voluntary position, but it is a position of responsibility for you, for your family, and for your community. And thank you.
Right, thank you for that, Mr. Murthy. Yeah, thank you. It's very useful. I've got, although we haven't got residents with us, so I'm going to ask you a few questions if you don't mind.
Please.
One of the questions I want to ask, you know, the people who refuse to take vaccine, and if they catch this virus, what will happen to them?
Obviously, vaccination is free in the sense that it's not enforced and everybody is free to choose, but obviously it has to be stressed, and we've seen it throughout the last 12 months that COVID is not a light condition. It's not just a flu as some have defined it, and the chances, especially among the elderly and among people who have certain conditions, and unfortunately also among the minority groups in our city, can be severe. Therefore, the vaccine is the safest and most recommended way to reduce that risk significantly, as the recent evidence has shown, and also reduce the risk to those that, even if they were given the choice, cannot vaccinate because of certain conditions that they suffer from that makes them ineligible to be vaccinated. People that suffer from cancer, or people who have immune conditions that make their immune system unable to take and develop immunity after a vaccine. So it's not just an individual responsibility towards you, for your health, towards your family, but also for the rest of the community and for the most vulnerable that cannot take on the vaccine.
The other question, just to follow up this, what measures are we taking to encourage people to take this vaccine?
The vaccination program is headed by the NHS, but as council we've been participating to multiple initiatives, and the COVID Champions is one, to spread information and to fight what is the infodemic of false information and fears that are stoked online in particular, that spread rumors and induce some people to wait or not to get vaccinated. We have engaged with the community locally, we and the CCG and the GPs in Birmingham have done as well, and we are encouraging the whole population to get the facts through COVID Champions and through meetings with community leaders and with patient groups.
Right, you know, this spread of this virus seems to be high in inner city wards and also within the BEM community,
yeah,
as you suggested in your report as well. Have we investigated why this is the case?
This is one of the.
Have we done any research on that? Like, you know, why?
Research is ongoing. There are a lot of elements that indicate why this is happening. Some of these have to do with the household numerosity, how many people live in a household, social contacts, but in general, especially when we're talking about the adverse effects of COVID, unfortunately, COVID has highlighted the very severe health inequalities that affect the BME community. And if anything, positive comes out of COVID is of having spotlighted the inequality that is experienced by these communities with regards to chronic diseases like diabetes, like obesity, which have been shown, or cardiovascular disease, which have been shown to predispose for a negative outcome for hospitalization or death, especially the members of ethnic minorities. And so a lot of research is being devoted to highlighting these inequalities and finding ways to resolve them. Within Birmingham in particular, in collaboration with Lewisham, we're working on the Birmingham and Lewisham Health Inequalities Review, which is focusing on the health inequalities experienced by the Black African and Black Caribbean communities first, and then we'll move on to look at all minorities in Birmingham to highlight again the inequalities that are experienced across the life course and propose solutions that could mitigate these.
How the hospitals are coping with all this situation? You know, if people have other disease, you know, like having a heart problem or cancer or some other disease, you know, they're suffering from, and are they able to get to the hospital and get a treatment on them, or are the hospitals are busy dealing with all these people with the virus and all that?
The hospitals, the colleagues in the hospitals are certainly very busy dealing with COVID, and we've seen it throughout the pandemic. And indeed, as you highlight, there is the added risk and the added morbidity and mortality deriving from the fact that, especially across the main peaks of the pandemic, there has been less access to chronic disease, chronic condition services. And I am afraid that at the end of this all, and hopefully soon though, we will start seeing the effects of the pandemic on other conditions. That's why it's very important to keep the focus on health inequalities across the board, and remember that there are chronic conditions that have been neglected, unfortunately, due to the pandemic, and it's very important, and the NHS is planning for it, that we, as soon as we are out of this horrendous pandemic, we start devoting again resources, full steam ahead, to make sure that these inequalities are dealt with and we catch up with the backlog of delayed meetings, clinic visits and interventions.
Right, thank you. I think I asked you enough questions, and I'm gonna see if Leslie or Neil got any question for you. Neil, are you still with us?
Hi, Councillor Hussain. Yes, I am. Yes, I have been kind of emailing some residents and what have you. You know, now that we have you, Dr. Motti. I personally don't have any questions because I think you've covered all of the areas appropriately. But I think that residents are, you know, I think the main concerns in Birchfield, they are around, you know, things like, you know, access to vaccines. They are around things like, you know, kind of social distancing measures and people adhering to the guidelines, because it has been difficult in some of the local shopping centres and some of the local shops and what have you. But you know, generally, I think that, as you've identified, there is a need also to kind of get people to come forward to become COVID champions also. So I'll be definitely putting that message forward to a lot of our kind of local community groups and things like that, and also directing them to the information that you've provided as well. And then if we receive any questions and queries in the meantime, I'll make sure that I feed them through to the public health team. But thanks very much.
I think before the next meeting, if we can organize and ask some of the community members within our ward in Birchfield in particular to do some recording message on like a video, so they can ask people to how important for people to have this vaccine. Is that possible?
I'm in contact, as you know, Councillor Hussain, with a lot of the community groups, so I can ask them definitely what they're doing. because we do know that there is an uptake within Black, Asian and minority ethnic communities. You know, elders of mine, relatives, you know, they're kind of living in around the area. You know, they've had their vaccines, and there are lots of people that I know, but it's, you know, the messaging is very, very important. So I will definitely ask what they're doing in the community. And also the councillors, as you know, have had a joint message which has been distributed as well, which has been very, very helpful. But yeah, you're right in terms of,
I think, you know, if we have some message, you know, we can play at our next Ward Forum meeting, which is taking place on the 17th of March. That'd be helpful.
Yeah.
Because if
I mean, that's a good suggestion. I mean, we'd obviously have to look into the kind of you know, the kind of data and communication rules and regulations of the council on that, and we will do. But you know, the councillors have obviously issued some messaging, and we should look and see what's happening within Birchfield as well, to see, as you say, whether something can be communicated also.
Okay, Neil. Yeah, that's okay then. Does Leslie has anything, or she wants to ask anything?
No, Councillor Hussain, just to say I've emailed everybody out about the details for the next meeting.
All right, thank you. Right, with this, Mr. Moti, thank you very much for your attendance, and I think it's been a very useful update as far as I'm concerned.
Thank you so much, Councillor, and thank you, everyone.
Yeah. Now we might trouble you again next month. Okay, right.
Thank you, Dr.
Moti. So the next one is you can stay and enjoy the rest of the meeting, or if you want to go and do some other useful things, then it's up to you. We are on item 4, which is highway update from a senior highway local engineer, Carl Randall. Carl, what I ask you if you could touch on, if you know, we had some devolved budget of 10,000 from Transport and Environment cabinet member. We did agree some schemes for Birchfield Ward.
Yeah,
I want to know that if what progress have we made on that?
Okay, Councillor. Well, yes, I'm pleased to update you on that. As you quite rightly said, we have the Ward Minor Transport Measures funding. It's a pot of money spread throughout the whole of Birmingham, and with consultation, liaison with councillors and public, we look to bring some local highway schemes and measures forward that we can do. One of my officers, Alan Woodcock, has been liaising with you on these, and I'm pleased to say that some of the works are imminent. The works are some drop crossings, some drop curbs on Wellesbourne Road at Hampstead Road and North Drive at Gibson Road. These are where we lower the curbs, which are normally full height 5-inch curb face, down to about 6 millimetres. What they do, they aid the crossing for people with walking disabilities, wheelchairs, pushchairs, mobility scooters. It just helps people go from one side of a road or footway to the other side. Because it helps the mobility, so they haven't got to step up or down high curbs. So we're pleased to be able to be doing those shortly. And also, I believe about the 15th of March, we'll be doing the build outs that was agreed on Putney Road at the junction, near the junction of Stamford Road. And we'll be building out the footways on there, putting some guardrail around and some drop curb with a tactile paving. And that tactile paving has a little nibs on, a little like rumbles on, and that helps to guide blind and partially sighted. So they know from their training that when they're on there, that they're at a place to cross. So as I say, all being well, approximately the 15th of March, they'll be commenced, so just in the next couple of weeks or so. We've also, outside of the ward minor measures funding, we've also put some guard railing outside of the one entrance of the school on Charles Road. We had a meeting with the head teacher and deputy there about some issues, so we've done that. And the school also wants some waiting restrictions, some yellow lines there. But what we really need to do, we found some funding to do the guardrail, but really the school needs to sign up to the government's Mode Shift Stars initiative. This is where the school get on board, do an updated travel plan, how the children get to school, currently, how they would like to get to school, what barriers or interventions or measures are needed. You know, why aren't they walking or cycling? Why they're reliant on the car, and then this helps to tease out what's needed in the area around the school, what highway measures, and this can lead to safe routes to school funding, which can be anything up to £20,000, and that can provide measures to help the parents and children get to school, but by those means of walking or cycling. It also entitles them then to have priority on enforcement. What we say is, you know, work with us, do your travel plan, sign up to Mode Shift Stars, get your parking box, do your lesson plan, try and educate the children through to the parents about, you know, not parking causing obstruction or danger, or causing a nuisance or inconvenience to other road users or residents. So it's a two-way thing. We're just waiting for the school, who were very positive about this. We're waiting for them to sign up to Mode Shift Stars. Obviously, with the way the situation's been in the last 12 months, with limited pupils, limited numbers, things not being as they have been previously, you know, it's understandable that this may take a little while longer. I'm also pleased to confirm the same ward minor measures funding has been agreed by the cabinet member for next financial year, which commences April, and so we'll be looking to be in touch with yourself to discuss what highway measures you'd like us to consider next financial year, which can begin really seamlessly from April onwards. I know recently Westminster Road was made into a cul-de-sac at the junction with Wellington Road. We've been asked to provide some cul-de-sac signs. So there's lots of bits and pieces, signs, bollards, barriers, railings, things like that we can work with you on to help, you know, address some of the issues in the ward with regard to sort of parking and other issues like that. So that's sort of a very quick roundup of the highway measures this year and proposed, you know, to begin for next year. And again, happy to answer any questions that you may have or your constituents.
Yeah. The question basically I want, you know, you talked about this having this meeting with the school. When did you have that meeting?
Oh, councillor, that was, I'd need to look in my diary specifically, but perhaps
I know it's been some time, because I have written to various people regarding
yes. Okay.
The head teacher or deputy head teacher basically written to me and asked me for assistance to get that problem sorted on that road, Charles Road. Why they haven't signed this this plan you're talking about?
I know it frustrates us a little bit. We understand that schools have their priorities. They need to educate the children. That's a priority. But really, if they can just do the updated school travel plan, which the council has a travel demand team that will assist with them, they'll work with them on it, they'll help and advise them. It really can unlock some funding to help things, because, you know, if you think the council, we don't know how the children travel to school. We don't know the radius, proximity of where they live. We don't know the reasons that they don't walk or cycle. We don't know if they feel it's unsafe to cross this road or that road, or if there's too many cars parking in this location or that location. So that's where we need this information. And it also, the travel demand team can work with the school on things like bikeability, training the children. You know, it really does, you know, for a small bit of work from the school, which they have committed to. The meeting was perhaps about 3-4 months ago, with the head and the deputy head, two ladies it was, myself and Alan Woodcock, and they're really positive about it, and there's so many benefits from it, that, you know, we did explain this, but unfortunately, you know, we have many hundreds of schools, and an awful lot don't do this, but we do try to get them on board.
The one I think they were requesting, Carl, it was sort of a zigzag lines outside of the entrance on Charles Road.
Yes.
And I think, you know, because she was really concerned about children running onto the road and people, you know, parking cars there and all that. Is there a possibility we could provide them that?
Yes, it can be provided. And what we've asked for is if they can get the school travel plan, if they can do that and apply for the mode shift stars, which is all very, very simple and straightforward, that there may be a whole lot more than that we can give them. You know, that in itself, the school keep clears, the yellow markings and the zigzags and the relevant signposts for them. It's all within what's called a traffic regulation order, a TRO process. It's quite a lengthy process. There's adverts in the press, consultation, a lot of work. It's possibly about £8,000, but all of this could be unlocked from the Safe Routes to Schools funding if the school got on board. Independent from that, you could consider it from your ward minor measures, but, you know, we only need the school to work with us on it, and, you know, we could get this funding hopefully as an addition to your funding. No guarantee, of course, but, you know, it really is worthwhile for the school to do this that would benefit them.
The other question I want to ask, this might not be in your remit, you know, I'm not sure. It's about this work which carers are doing, you know, through this PFL scheme.
Yes.
You know, some of the roads in my ward was due to be done when Amy had the contract.
Yes.
And in particular, the road I want to mention is Churchill Road. And on Churchill Road, the residents had the letters saying that the road will be serviced, you know, and date was given. And then this relationship between council and Amy, it come to a stage where there was no progress on these work to be carried out, and since Kara took over, I just wanted to know what's happening to those roads. You know, when they're going to be done, because I would have thought, you know, if they were to be done, you know, when Amy was around and when these people took over, they should have been doing those roads in the first phase. So is there any chance either you can take it back and just find out what's happening with them?
I will do. I mean, Amy won the PFI contract June 2010 for 25 years, and things were going well for a good few years. The first 5 years of the core investment period, you know, 50,000 streetlights were replaced, brand new, roads were resurfaced, footways. But then, yes, there was a dispute between the authority and Amy. That period then saw Amy only doing pothole and patch repairs. All main resurfacing was suspended till the issue was resolved. It was resolved, and Amy and BCC parted company, and Kia Highways have now got the interim period of about 18 months. It is from when they took on. So what we have now is an amount of work that Birmingham Highways Limited are doing. Now, I'd have to see if the road you mention is proposed in these interim works, or if it's going to be something that comes on in line at a later date, because the remainder of the term will still of the original PFI will still have to be procured with somebody, and it may be Kia going forward, it may be somebody else. So there's a couple of avenues I need to check. Is it with the Birmingham Highways Limited interim works, of which you'll see a lot going on at the moment around Birmingham, or is it something that's going to be in a future programme of works? Now, the longer term future programme I haven't seen the detail of. We only sort of see these interim works because my team do the temporary traffic regulation order for the road closures, so we see what's coming on board in the next sort of few weeks and months. So did you say it was Church Hill Road?
Church Hill, yeah.
Church Hill. Okay, let me look into that for you. I'll have to drop you
also,
an email.
while I got you, I take a benefit of this. Bracken Road, which is off Gibson Road.
Yeah.
Now the street lights. If you drive around in Bracken Road, and you'll see how bad the street lights are there. They're really dim, you know, and the lighting is so poor. And this was due to be done when Amy took over and had the contract, and it was in the first 5 years phase, and that work hasn't been carried out. Right. So if you could check that out for me,
I will do,
why that is the case, because I don't feel that it's fair on the residents, you know, when you have these changeovers or swapping, you know, from one contractor to another. And I don't think it's fair on residents to you know, lose out like that. Yeah. So if you could check that for me,
I will. That's a lighting in Bracken Road as well.
Yeah, and I don't think I have anything else. There's the other thing, you know, which you mentioned, you know, that you do all these road closures work, and your team does that basically. Yes. But I don't see any work progressed in my ward. There's no work going on in terms of road, you know, development, or you know, there's no bigger projects taking place in this ward. I don't know why. I mean, you mentioned other wards, but you know, I could mention Lozells. You know, Lozells got some work, some sort of work going on there in terms of improvement to the roads and all that. But in this particular ward, Birchfield, I don't see any improvement going on in terms of road surfacing or doing things like that.
Okay. At the same time, I look at the other two queries. Let me have a look at the interim programme, and I'll let you know if I can see any footway or carriageway works in Aston Ward, in Birchfield Ward, and I'll email those to you, and I'll let you know what's forthcoming.
Yeah. You know, you did mention about that the cabinet member also retrieved further development budget for these wards. You know, I would thought, because there's few roads where people have petitioned. They either want road amps, you know, or they want something else, you know, to slow the cars down. I would thought, you know, if we need to do anything with that money, then we should start on those roads where those petitions have been presented. And this is why one reason we're having this built out at Putney Road, because we had a petition from the residents, from the residents saying that you know, there's a must there, and the children are crossing the road. It's not safe for them, and that's why I took it up with Ellen, and Ellen kindly draw up a scheme which is going to basically, you know, the children of the area will benefit from that.
Yes.
So with this, I don't have further question for you, Carl. But I don't know whether Neil got anything, or he just wanted to say anything before you go. Or Leslie?
Thanks, Councillor Hussain. Just a couple of things that have come to my attention. Obviously, there's a lot of activity going on in and around Perry Bar at the moment with the removal of the flyover, etc. So, you know, residents are obviously, you know, kind of interested in that, and obviously as we ease out of lockdown, you know, there no doubt will be increased traffic volumes and things. So it's not a question or anything like that, but I'm just giving an update on what's at the forefront of residents' minds in terms of all the development and what have you that's going on in Perry Bar. And another
Neil,
couple of things. Yeah.
Just on that, Neil, sorry, I know it wasn't a question, but funny you mentioned that. I was at Cabinet Member Brief Monday, and Councillor Zaffer did say that he drove the area on Monday morning, and everything appeared to be working very well.
Yeah,
and also the traffic manager.
I think the cabinet member would say that, wouldn't he?
Okay.
If he say it wasn't working well, then obviously something going on.
Okay. Also, the traffic manager confirmed that last week's figures show around 70% of traffic on the roads now, so it's increasing. So with 70% of the previous capacity, initially and hopefully, you know, things appear to be working, but let's continue to monitor. So although it wasn't a question, I thought I'd just comment on that now.
No, and I'm glad you did, Carl, because obviously people are aware that the schools are going to go back, you know, from the 8th, and as we hopefully ease out of lockdown, volumes are going to increase. But it's good to hear that initial report, and we'll keep an eye on that. Another couple of things that have kind of come to the fore, which I know that you're aware of. So, you know, with the inclement weather that we had recently, I know that it was out of the ordinary, but provision of grip bins, you know, on certain streets, particularly gradients, you know, is something that we just need to keep, you know, an eye on for the future in terms of that. And gosh, there was one other thing that I wanted to mention with you. Yes. So in the past, what's been really, really helpful for residents, and I don't know with Kia whether it's a possibility, but in terms of when works have been planned, in terms of things like street lighting improvements or road improvements or what have you, in the past, there has been a programme, and it's been really, really helpful within wards to have an idea of when certain things are going to happen and where they're programmed in. So, you know, in the future, if you are speaking to, you know, the contractors, I just think generally, as much information as we can, and I know it's always subject to change and different things in terms of the programming of works. It just helps to keep residents updated on where things are. But thanks, I know that you and your team are fantastic, and you do respond and help us considerably. So thanks for that.
Thank you.
I just wanted to say with this flyover Perry Bar, I do drive around there, Carl. And I find, you know, going out of city, it's a bit of a problematic because you have a lot of congestion, you know, on Birchfield Road, and coming in from towards city, it's not so bad, right? I think Neil did touch on the school, people returning to the school. 8th of March. I think that's gonna be, you know, testing time, and that's when you will know whether what sort of you know, problem people gonna have, and how long they're gonna be stuck in that traffic. Because up to yet, because we've been in lockdown, and people hasn't been going to, you know, children's have been going to school, and people are not going to work, and they're all doing work from home. But as time goes along, you know, and they're easing off all this lockdown, then obviously the traffic will increase. And when the traffic volume will increase, then that's the time you will see that, you know, people will have to queue up, you know, or they will stuck in the traffic.
Absolutely.
Yeah. With this, I don't think I got anything else for you, Carl. And I just would like to thank you. You know, I think you've been great. You know, it's been a good update, you know, and I think I'm really pleased that you have. I don't know whether I met you before or not, but I certainly, we have exchanged emails.
I think in the past we have. This is my 38th year, so our paths will cross.
You don't look that old,
I was 16. I was very young then.
God, 38 years you've been with the council.
Yeah, this year, yes. I used to build roads and footpaths for the first 10 years.
I must have met you somewhere then, because I've been around some time now as well.
Yeah, I used to look after Perry Bar from about 2002 to 2005, a bit before the devolution.
I must have met you. Yeah. But anyway, thank you very much for your attendance.
My pleasure. Thank you very much.
Thank you, and you look after yourself. Okay, keep safe.
I will do. Thank you for inviting me. Thank you.
Bye now.
Bye-bye.
Bye-bye now. I mean, the next item is a policing issue. We haven't got any police with us, but what we have, it's an update from them. And what I'm going to do, I'm going to read out the update they have sent me. And yeah, here we are. Now I got this update from Sean Stanley, who's our sergeant for the area. And it says, "Dear residents of Birchfield ward, I hope you are well, safe, and doing all you can to protect yourself and your loved ones from your families. Our policing team have increased our patrol in the area during this lockdown period. We have been working with the environmental health officers, engaging with the residents and the local businesses, and on occasions having to enforce the rules. I'm happy to say that the vast majority of the public have been abiding by the rules and doing their bits to ensure that we can get closer to a norm we used to enjoy. Operation Relent is forced a wide operation and have been in place to tackle suspect COVID breaches which have been publicized in the local and national media. Operation is to continue for foreseeable future, and as neighborhood officer, we will play our part in dealing with any breaches. Most of you will have seen the Prime Minister's announcement with regards to the easing of national lockdown measures. I like to believe that we will come out of this after lockdown, but we still need to play our part so that this happens. But more importantly, to keep yourself and your family safe. Please ensure that we follow the new rules law as they come into effect from 8th March 2021. School will reopen, taken from the government website, other easing of the restriction as follows. Also from this date, work around children care and other supervised children activities can resume, where they enable parents to work, seek work, attend education, seeking medical care, or attend a sport group. Care homes residents will be allowed one regular visit provided they are tested and wear PPE. The stay home requirement will remain, but people can leave home for recreation outdoor and such as a coffee or a picnic with their household or sport bubbles or with one person outside of their household. Some university students on the practical course will be able to return to face-to-face learning. Future restrictions will be eased from 29th of March pending success of each stage. Please visit the government website to ensure you are up to date with what they are. Our officers will continue to engage, explain and encourage as the restrictions are eased and enforced as last resort. If any has any questions for me or well, basically is asking if anybody got any questions for Sergeant Stanley or his team, please email his team on lozels@westmidland.penpolice.uk. That's the report from the police sergeant. So we're done with that. The next item is this matter of local concern. I just wanted to, I don't think we got to, we had the residents with us this evening, then obviously they would have been raising some concern. But I thought, I could also mention a few things which I wanted to mention. One of the things I wanted to mention was basically about this devolved budget which we received from Cabinet Member of Transport and Environment, and Carl Randall has touched on that. But the other thing is that at our meeting, a council meeting on 2nd of February, we did agree a report on fly tipping, and council have agreed 7 or 8 recommendations, and there are all good recommendations basically. One of the one recommendation 1, it basically talks about name and shaming people who do fly tipping if they get caught. Right, and also there's more than one recommendation. As I said, it's 7 recommendations altogether. Right. One recommendation talk about the naming and shaming. Just a second, let me get that picture out. Right, recommendation 1 is the naming and shaming should be introduced in Birmingham, backed by investment in mobile CCTV cameras. The cabinet member is asked to report back to timescale and implementation, the Housing and Neighbourhood Scrutiny Committee. Then there's a recommendation 2 talked about CCTV. Our recommendation 3 talk about review of persecution on fly tipping, and particularly the use of a fixed penalty notice with the view adopting this barking and dung approach should be undertaken to ensure that this fits what is needed correctly. That's that. And also recommendation 4 talked about this community protection officers, and recommendation 6 talk about the local community groups that clear rubbish or hold litter picks and sport by their local depot with waste collection, and the cabinet member look at whether the community clearance of communal land and back alleyways can also be supported. Basically, all these 8 the recommendations have been agreed by the council, and hopefully it will get implicated sometime after the new financial year. Yesterday, with I got this. Yesterday, I think the council has agreed a discount of £275 for all Birmingham households receiving council tax support to be applied to their 2021 and 22 council tax bill. This discount will support around 61,000 of the city most struggling household, and means that all CTS recipients will be protected from this year's council tax increase. Around 31,000 of these households will now not need to pay any council tax for the 2021 and 22 financial year. Well, this was agreed yesterday, so I thought I mentioned this. Right, Neil and Leslie, are you still there?
I'm still here.
All right, I don't see you.
There you go, got my camera on.
Yeah, okay.
We're still here.
So I just thought I let the residents know that, you know, this recommendation have been agreed at last council meetings. So, you know.
Very good.
It's very good to have that information. Thank you.
Yeah, we're going to get this meeting out onto YouTube tonight. Aidan's very kindly volunteered to download it for us, and then as soon as I get notification of it, I'll email all the residents. Okay.
All right, that's fine, Leslie. Yes, that's fine. So what I will do, I'll put 17th of March in my diary.
Yeah, 17th of March on Zoom.
On Zoom, yeah.
At 6 PM.
You already said that.
Yeah, 6 PM.
What time are you thinking of holding this meeting?
Is 6 PM okay?
You can stop the recording now, you know, we don't, because we're having a chat between ourselves.